Good morning, good afternoon, and good evening, and welcome to our first IASAS knowledge session. We are extremely excited to have you joining us for this next hour. Very quickly, a couple of housekeeping issues to help the session operate and go through quickly. First off, we ask you to stay muted at all times to minimize background noise. If you'd like to have your camera on, that would be great. We love to see faces. If you need to keep it off, that's fine as well. Please feel free to use the chat if you have any issues. The session will run for about 30 minutes of presentation, and so both of our presenters will leave adequate time at the end for Q&A. You'll be able to interact in a variety of avenues. They will prompt that when we reach that stage of the presentation. So I just want to again welcome everyone. I want to thank our presenters for taking their time and spanning various time zones of the globe. We typically have anywhere between 8 and 15 or 16 time zones from either presenters, attendees, and whatnot. And one thing that we do appreciate in these sessions is if you can just kind of put what country or what part of the world that you're joining us from. But it's always fascinating for our presenters and for our attendees to see how wide of a span that we have. So if you feel free to put that in the chat as things get going. And so at this point, I'd like to introduce our presenters and let them introduce their session. We have Dr. Kerry Klima, who's joining us from California, and Dr. Jeremy Doughty, who's joining us from London. So I'll turn it over to them. Thank you for being with us.
Hi, everybody, and welcome to our session today. Thank you, Tad, for that kind introduction. My name is Dr. Jeremy Doughty, and today, along with my colleague, Dr. Kerry Klima, we'll be sharing more information about our recent research study, which focused on the wellness of international educators during the coronavirus pandemic. We'd like to get started just with some introductions about our organizations and our backgrounds, and then we'll continue with an overview of our presentation. So my name, again, is Jeremy, and I work for the University Studies Abroad Consortium, or USAC, which is a US-based education abroad provider that was established in 1982. And what's really interesting about the organization is that we started with a focus on study abroad in the Basque Country, but today we have more than 50 programs that span 26 different countries. The majority of our students are coming from the United States just because we're operating as part of a consortium model. As for my role and my background, so I serve as the resident director for USAC's 4 program locations in England, so in Brighton, Bristol, London, and Reading. And prior to that, I served as the director of study abroad at St. Norbert College, which is a Catholic 4-year institution in the state of Wisconsin in the United States. Kerry and I first connected at Bowling Green State University, which is where we both earned our PhD in higher education administration. And during my time at Bowling Green State University, I worked in the university's community engagement office. So my research interests really are at that point of intersection between international education and community engagement. My doctoral research focused on the impact of global service learning programs on South African community members. Of course, because we were all living and working in a pandemic, my research interests have taken a bit of a turn, and I've been working with Kerry on this current research study. And then I'm also working with another colleague that is exploring the experiences of students who are currently studying abroad during the COVID pandemic. I'll turn it over to Kerry now for her introduction.
Great, good morning. I'm Kerry Klima. I am in Southern California, in Long Beach, California. I work at California State University, Long Beach. We're a large public institution, a part of a system of 23 campuses in the state of California. We're an access-based serving, community serving institution where we have around 38,000 students. We're a Hispanic serving institution and an Anapeasy institution. And really, I have had a variety of roles in student affairs and higher education that really have informed my practice and my research. I'm very much interested in student affairs staff and their experiences. I've worked in academic advising, career services, student organizations, student activities, different supporting students from low income first generation backgrounds, students of color. So currently right now I serve as the Associate Director for Assessment and Evaluation in our Division of Student Affairs. So I'm a bit of a data person, mixed with I also serve as the Director for a McNair Scholars Program in preparing students for PhD programs after they leave Cal State Long Beach. Like I said, I'm very interested in staff wellness and staff experiences. So when I was with Jeremy at Bowling Green, I studied the experiences of staff in student affairs who identified having a mental health condition and what their experiences were like and really thinking about their wellness. But I also have studied and published around professional development and the growth of our staff in the field of student affairs in the US. And so we're really excited to see you all today. As an assessment person, I am required to include learning outcomes in anything I present, as I have to practice what I preach with the folks that I work with. And so today we really hope that you'll take away the ability and the excitement to describe the importance of staff wellness during student emergencies and crises, as well as identifying organizational and structural implications related to staff wellness as we think about this work in student affairs and international education. And that we also hope that you are able to create one idea or initiative for practice that can really proactively support staff in their well-being prior to when a crisis occurs. So we'll talk about some of those ideas and things that we found from our research. Tad gave us a bit of a context or an overview. I always like to do this. I like to know where we're going. We're going to talk a little bit about some highlights from the literature that grounded our study, as well as the overview of what we did in our study and how we conducted it, as well as the findings and our initial discussion and implications, but really rounding out and having that Q&A at the end where we would like to talk with you all about what you're thinking and the reflections that you've had upon listening to our findings in our study. And so to get us going, we try to have a little bit of an interactive experience. We do want to start and launch a poll for you. So when I launch this in a couple of seconds, there's going to be a variety of questions. If you can just respond to those as you can, and we'll give you some time and then we'll kind of summarize some of the responses. Great, we have a lot of responses. We're almost, I know on your end, you've probably submitted or you're still waiting, but on our end, we can kind of see how everything is coming in. So thank you for your patience. We're close to almost full participation in the poll, so thank you for contributing. Okay, we're very close to almost everyone. Should we start, Jeremy? Just kind of.
Yeah, let's
Okay.
get started with the discussion.
Okay. So, as we asked our first question, what effect did COVID have on your work was the first question. And it was 63% had a major effect. And so we see almost everyone saying it had at least a moderate or major effect on your work. And so we know that this is pretty in line with what our study also identified, is that we do see this effect that COVID really influenced how our work occurred and or the response that we had to take. And so now we'll kind of connect and think about how that work-related response maybe affected your wellness. And so the next question we asked was, to what extent was the work-related response to COVID, and how did that negatively affect your wellness? And I would say we had almost a little over half that said moderate negative effect, a little response on a major negative effect, and a little bit under half of a minor negative effect or no negative effect. So I think this again is also a little on par with our staff, where that we studied, that there was some different responses. Some staff were okay and they didn't really see as much of a negative effect on their wellness, and others had a much greater effect on their wellness. And so it speaks to just the differences where staff are coming from and the experiences that we all have, and I think where we're also situated and sometimes our roles. And so those things can very much influence how our wellness experiences take hold when we're responding to things such as a crisis like COVID. And so the next question is, to what extent has the work-related response to COVID positively affected your wellness? And we're actually seeing very similar results as to the negative effect, which is always really interesting, right? I think the other thing to point out is this has been a long-standing response, right? If we're talking today, we're talking a year. And so maybe our wellness stories and our responses may have changed in this time, but also kind of recognizing that some folks have had new wellness experiences that have been able to kind of foster or be created because of this environment of staying at home. And I think we definitely saw that with some of the stories that our participants shared. And one of our last questions is, my organization has a responsibility to support my overall wellness during times of crisis. And so this one is really interesting because there's a negotiation of what the role of the organization is when we're talking about staff wellness and what the role of the person is. So I am pleasantly happy with the responses that most of you all said agree or strongly agree that the organization has a role in that. And not to say that the individual doesn't have a role, but I think it is important that we're thinking about the organization's role in contributing to wellness during these responses. So thank you for sharing that. And then lastly, the last question was just kind of getting a sense what your all's experiences were. So my organization provided blank support related to my wellness during the COVID pandemic. And we see a very distributed overall, I would say. So we have distribution pretty closely even in a little, some, or a lot of, with a couple of folks saying no, they did not provide any support. So this is fascinating to me because we see the variance across our organizations in what the organization did do to provide that wellness support during this time. And so this is really leading into, you're giving us a great base for why we thought the study would be great to inquire about and really think about what we can learn from this. So thank you all for participating. And
All right, very good.
So, yep, thank you.
Yep. We'll move on with a very, very brief overview of the literature. We want to spend most of our time today talking about the actual findings of our study and then what some of those implications will mean for higher education professionals in different functional areas. So I'll get us started with a really quick overview of COVID-19 and global education. So in terms of the higher education landscape, of course, universities and organizations, both public and private, really face immediate financial problems as a result of COVID-19, right? Many institutions and organizations have eliminated programs. They've introduced furloughs, made some faculty and staff redundant, and have even stopped hiring new faculty and staff. Now, for those institutions that have faced, really complex questions about survival before the global pandemic, these conversations have become much more immediate. Now, although that picture is rather grim, Altbach and DeWitt argued that broadly, global education will remain fundamentally stable. Yes, we will probably see significant short and medium term consequences and disruptions, especially as the crisis continues. But arguably, they said we will be fine in the long run, and I have some data from the Institute of International Education that will support that. Now, Conway and colleagues added that preparing for this post-pandemic study abroad and higher education more generally will really challenge each organization and their risk tolerance until the future is known with greater clarity. Even after travel warnings and restrictions lift, we will really have to consider a whole new set of issues, especially in the field of international education. Redden, as you see here at the bottom of this slide, even noted that the study abroad field has never faced a moment like this. Now, the Institute of International Education in July of 2020 administered a survey about the impact of COVID-19 on US education abroad. In total, 520 universities and colleges completed this survey. And as we can see on the bottom left side of this screen, most study abroad programs in fall 2020 were canceled due to the ongoing COVID-19 pandemic. And institutions really started to restrict their programming. We see that 64% of universities canceled their fall 2020 programs, and 27% noted that they would offer some either in-person or virtual programs. But due to these widespread cancellations that affected not only fall 2020, but also the spring 2021 term, the majority of institutions noted that they would see a pretty significant decline in the total number of students participating in their education abroad programs. And we see that displayed on the bottom right-hand side of this slide. So about 79% of colleges and universities expected a substantial decline in study abroad, and 15% expected some decline. But positively, 84% of those institutions that responded indicated that they were going to continue to promote study abroad, starting with the summer 2021 term and moving forward from there. I'll end this section with a glimpse at some historical data from the Institute of International Education. So as we can see on this slide, the Institute for International Education released really helpful data regarding the participation of US study abroad students during health crises. And as we can see in these figures, after this temporary decline in participation, US students resumed studying abroad in East Asia following the SARS epidemic, and we see that in the top left chart. They continued studying abroad in West Africa after the Ebola virus epidemic, and that's the chart on the top right. They went back to Central America after the swine flu pandemic. That's the table on the bottom left. And then again, they went back to South America after the Zika virus epidemic, and that's the table depicted on the bottom right. But as we look at these charts that detail epidemics and pandemics in the 21st century, and we don't have data yet on the impact of COVID-19, doesn't it make you curious to know more about the effects of crises like these on higher education professionals? So now I'll turn it over to Kerry, who will give us a brief summary of faculty and staff wellness.
Great, thank you. So what we know about higher education professionals is there's an interesting nuance that oftentimes we're considered helping field or a helping profession. We're continuing to help students in their learning, growth, and development. And oftentimes we are tasked in responding to crises. But in the literature, we don't really talk a lot about what the norms are as professionals in what that that experience is like for us and our well-being and our wellness. If we look at other first responding or crisis response organizations, if you look at counseling, if you look at first responders in police or healthcare workers, we're seeing so much of that literature that's already been in existence and expanding right now in regard to response with COVID-19, that we know that that work is emotionally laborious when we're responding to this crisis for those staff members. And so as we looked at our study, we're starting to see more literature in regard to recognizing the labor that it takes to support as a higher ed or a student affairs professional in supporting students with these crises. And so one of the things that I studied in particular is around mental health, and we'll talk about the differences between mental health and wellness later. But Lamontague really recommends that we think about integrating mental health intervention into the workplace, that by requiring the individual to just seek that support on their own outside of the workplace isn't going to be an effective strategy when a lot of the concerns that really can connect to someone's mental health is actually situated in their work environment. So I studied the experiences of professionals with a mental health condition as staff members, as well as looking at some of that work of the emotional labor and this ideal worker norm, that the ideal worker norm we're trying to challenge is that you're just kind of there operating for the organization, output, output, output. If you leave, that's fine. We'll just put someone else in your place and they can continue to output. And so really deconstructing that and getting that it's a very US centric focus of getting out of that idea that we're just kind of production and thinking about we are people and that we are humans that are doing this work. And so another layer that we use as a foundation is we do see some things in the ACPA and NASPA professional ethics and competencies that say that it is the responsibility of the professional to take care of themselves, that they need to be okay to do this work. And so again, we see that tension similar to in the poll of who's responsible for this. Is it the worker? Is it the organization? And so we're starting to learn more about what people are finding in the research around what that looks like in higher education. And similarly, as we think about it in particular to COVID times, and in the early response last spring, this is one of the top things that campus presidents were most concerned about. In the US, they surveyed the campus presidents of what are you worried about in this time in regard to the US and operating with these stay-at-home orders. And in 19% of the presidents said, which is a pretty high number in comparison to their other responses, that the mental health for faculty and staff were in the top 3 pressing concerns. And it was 25% in April. So recognizing the influence of this kind of very quick shift that had to happen in this time period, and that was very much a concern for the presidents, but that kind of started decreasing. So I'd be curious if they did the survey again in the fall, would the presidents have that same concern, or are they kind of going back to the typical operation where we're not paying as much mind to the experiences of our faculty and staff? And so really we're now also starting to see this idea of what does wellness look like in regard to COVID-19 exposure when returning to work. So we're seeing more institutions open up. We're seeing this kind of tension between safety and security for staff and that heightened concern around anxiety of returning to campus and serving when we're still navigating the fact that we have a lot of stay-at-home orders and or not as much vaccine distribution in the US at this point. So this is really what kind of grounded our framing as we entered into our study. And then now we will dive into the actual research that we conducted.
Yes, let's get into the fun stuff. So the title of our study is Navigating the Coronavirus Crisis, a narrative study of international educators' wellness. So again, COVID-19 is not the first crisis that higher education professionals have faced, and it will not be the last. So as we've just mentioned, the field of international education in particular really underscores the health, safety, and security of students, but we're not seeing that so much for faculty and staff. So our research question you can see here on the slide is, what are the wellness stories of US-based international educators who work for an organization that recalled students from their study abroad programs as a result of coronavirus? Now, we used a narrative inquiry for this research study, and this really begins with individuals' lived experiences and their stories of these experiences. One of the defining features of narrative inquiry is a really strong degree of collaboration between the participants and the researchers. And a second distinguishing characteristic of narrative inquiry is called the three-dimensional narrative inquiry space approach, which concentrates on sociality, continuity, and situation. So sociality refers to this integral relationship between an individual and their social context. Continuity really helps us focus on the past, the present, and the future. And then finally, situation captures the environment where the inquiry and the experiences take place. So moving on to the next slide, after Kerry and I received institutional review board approval, we recruited our participants. So with my background in international education, I connected with colleagues in the field to select an education abroad provider as our research site. Now, to honor and respect the confidentiality of our participants and the organization, we are not going to offer clear details about that organization. We'll simply refer to it as IGEE, which is a pseudonym for the Institute of International Experiential Education. You do, however, see a few more details about our participants in this table here. So since the intent in narrative inquiry is to really elucidate the particular, our study included 6 participants at IGEE. You can see in this table that we were really mindful of recruiting a diverse group of participants with respect to their functional area, their career level, their gender, and race. Again, the names that you see in this table are pseudonyms to respect the confidentiality of our participants. So how did we collect our data? We conducted 2 interviews, and then we had our participants author a written narrative. So in the first interview, which was roughly 1 hour in length with each participant, we focused on the organization, work in a pre-COVID world, and work experiences in response to the pandemic. In the second interview, which was roughly 45 minutes in length, we focused on sociality and the future of the organization, the participants, and the field of international education. And then as part of that written narrative, we prompted the participants to address 2 questions. First, we wanted to learn more about their lived experiences of working throughout COVID. And then second, we wanted them to write a story of strength, which could be fictitious. After we had analyzed all of the data and authored the first draft of our findings section, which we'll refer to as a re-story, we shared our findings with our participants, and we allowed them to give us feedback, and we treated that feedback as additional data. So let's take a closer look at what we found. So in our manuscript, we present our findings in script format, which was really, really fun for us to author. This approach really foregrounds the lived experiences of our participants that took place in their everyday lives with IGEE. And our aim is for the manuscript to really serve as this unique time capsule for what life was like for higher education professionals, especially international educators during the coronavirus pandemic. So what we found is that organizational and job-related factors really affected our participants' wellness. I'll briefly showcase some of these findings in the script format, and then Kerry will provide a much deeper analysis. So one of the first organizational factors that we found was this vicious cycle. Our participants really felt like there was no end in sight with respect to the ways that COVID has affected the organization. More than one participant actually referred to it as this vicious cycle of designing education abroad programs and then having to change or cancel them. Overall, we found that this really had a negative effect on our participants' wellness. We see highlighted here, Beryl mentioned that it didn't do much for her wellness, and we heard many other stories from our participants that it caused them stress and anxiety. Another organizational factor that affected our participants' wellness is related to communication. Now, especially at the student-facing program advisor level, we found that IGEE relied on its regular patterns of communication, which was much more reactive than proactive. Moreover, the information from the crisis management team wasn't really trickling down to the program advisors in a timely fashion, and this really negatively affected their wellness. We see here at the bottom of this slide, Christian noted that everyone outside of the crisis management team did not have all of the information to have clear conversations with students and their families as the crisis was unfolding. And he noted that this really put him in a stressful situation. Another organizational factor that positively affected our participants' wellness was the support that they received within the organization. So fortunately, throughout the crisis, the managers at IGE were really good about checking into their team members' lives in a really informal manner. And as you can see from the excerpts here on this slide, our participants really expressed a deep level of appreciation for these efforts. And we found that this positively affected their wellness. We can see Cindy, for example, noted that her manager is really good about checking in. And she even commented that she stayed with the organization so long just because of the strong environment that her manager has created for her. And the final organizational factor that we want to draw to your attention regards the industry, so the broader field of international education, along with the organizational health of IGEE. So our participants, we found, were really attentive to the ways that COVID has affected the broader field of international education, and their responses to what was happening within other organizations and institutions, especially as they observed reductions in staff or furloughs, really negatively affected their overall wellness. It made them anxious about the health of their own organization. What we found was really interesting is Beryl spoke about these layers of anxiety, and she explained that what she observed in the field of international education contributed to one of these layers. So in addition to those organizational factors, we also observed a lot of job-related factors, and one that was pretty robust was the shift in work responsibility from their life in a pre-COVID era to what they're doing now for the organization. Here we see that Christian, who's a program advisor, explained that he felt really comfortable managing his work responsibilities in a pre-COVID life. But he shared this really interesting story with us that captured the extent to which COVID overwhelmed him. He had one situation where he just felt so overwhelmed at work that he had to leave the office space, go to the bathroom, and cry. Another job-related factor that we were picking up on was the shift from office-based work to home-based work. Now, although 2 of our participants typically work from home, 4 of our participants were office-based employees before COVID. And these employees spoke in a very positive way about the social opportunities that the IGEE office offered. And as we can see from the conversation on this screen, they unfortunately felt that virtual engagement opportunities could not replace the more organic social setting of the office. And generally, we observed that the shift from an office-based to a home-based work negatively affected our participants' wellness. We see Christian saying that he felt like the office felt more like a unifying force for everybody. And Ivy similarly said that she was really keen on those social aspects of the office. Interestingly, the participants also spoke a lot about the shift from going from home-based work back to the office. And they really had mixed feelings about this, as you'll see in the re-story here. So some of our members, some of our participants expressed discomfort, and others discussed really how much they're looking forward to going back to that social setting. Our participants actually had really, really good suggestions for a more thoughtful, intentional, and gradual approach to returning to the office. And it hasn't happened yet. Everybody's still working from home. So we anticipate that the return to office-based work will really have a mixed effect on our participants, because we have Ivy saying that she really hopes that the whole COVID situation leads to more opportunities from working from home. But if she needs to go back to the office, great. She loves that social setting. Whereas Cindy said, I don't really feel comfortable going back to the office. And then finally, of course, finances and job security came up. So although we heard some stories from our participants that, some of them, like Cindy, as we can see from the top, she was able to save some money by working from home. Those were also balanced with some stressful stories from other participants about some of the anxiety that the furlough days caused. Also, some employees left the organization between February and October of 2020, not any of our participants, but other people, their colleagues, and those positions were not refilled. So the departures of those employees caused a little bit of extra work that negatively impacted our participants' wellness. So to help us make a little bit more sense of what all of this means, Kerry's going to give us a summary of some of our kind of major takeaways and thoughts.
Great, thank you. So as we were reading through all of our stories and thinking through the stories that we had, two questions kind of came to mind to help us answer our original question. So our original question was, what are the wellness stories of US-based international educators who work for an organization that recalled students from their study abroad programs as a result of the coronavirus? So the wellness stories we saw happening in two layers. There were factors that affected our participants' wellness during this time, and then what did those factors contribute to or have an effect on their wellness? And so really we saw, as Jeremy described, two layers that were happening in terms of factors. We see this bigger perspective, organizational perspective, and then very much centered on the specific job tasks the person had to complete and how those things shifted. We did see as well, and as Jeremy talked about that time capsule piece, in the initial data collection stages and in the first parts of the interviews, they shared stories of recognizing that they felt pretty comfortable and confident in the organization's health and that they were going to be doing okay. And then we saw by the second interview that furloughs were happening, right? And then seeing other indicators of other organizations have to file for bankruptcy or to lay people off, you can see that tension started to grow for our participants and that stress increased, being concerned about what this is going to mean for kind of these next stages. So as we think about the literature that Jeremy shared in regard to these trends, it's hard to kind of sometimes look forward for our participants for 5 years from now and saying, okay, maybe by then we'll have rebounded and be okay. They're looking at very much that immediate aspect and how that's affecting their stress level and their wellness. Communication was another thing that we talked about, and I think it really flowed with their like Jeremy said, the typical organizational structure. We saw the communication happening very much up and down. When we heard Christian talking about the experiences of whoever's in the team and in that meeting is having one experience, and then there's other aspects. And so, one of the things is it came down to is the style of the supervisor made a difference. Thinking through how the communication happened, that it was very sparse in terms of varied people giving communication. And so as we think about the literature, one of the things we know about leadership and organizational theory, right, is that having multiple points of contact for communication are important. They need to hear from a CFO type figure. They need to hear from, their supervisor, but also their managers above that to understand the context of the organization, as well as the support factor. So Jeremy talked a little bit about that. And I think the interesting thing is, initially the participants described missing that in-person environment, that's where they found a lot of their support and that they could not replicate it. But by the end, everyone was adjusting to this virtual environment and figuring out ways that they did actually find support. They didn't overtly say it, but that's what we could read, was that they actually did have these support in the organization that they made do and kind of responded and figured out what they need. But as we think about their wellness, recognizing that those supports are changing. And so as our support structures are changing in response to crisis, you saw their wellness experiences changing. And so I think it speaks to the nature of this work and needing to be agile so often, and that is going to help and maybe potentially fluctuate the wellness experiences as well. So the job-related factors, so work responsibilities, the pre-COVID versus COVID, expanding those different things. Our participants described how, maybe they were able to keep a more typical 8 to 5 structure, but in those first 2 weeks, 3 weeks, they were working hours upon hours upon hours, right? And so what we know about well-being is we need sleep, we need nutrition. And so thinking about when we're shifting these responsibilities and having to respond from crisis in short term and kind of medium and long term, how are we structuring that work for our participants, or thinking about what that's like that is going to encourage positive wellness or positive well-being. And that, thinking of this environment and their work environment is kind of, again, like connected to that support feature, is that adjustment that, some folks are going to do well in these adjustments to a work environment, and some folks are not going to do well. They described just different experiences of, I really like working from home. I hope to continue to. I'd like to have that flexibility. And that's very consistent with the literature in regard to mental health, wellness concerns around staff, is, allowing for that flexibility allows for the individual to identify structures that work best for them and their wellness. And so I think that's what comes through here, is having the participant, or in our case, the staff in this situation, being able to kind of just define what that looks like for them in their environment is something that they would really like to help their wellness. Job security, again, that vicious cycle, concerns of cancellation, when those cancellation emails would come through, or the adjustment emails would come through, we'd see this spike in concerns around their wellness. And then certainly we know, in terms of basic needs concerns, finances, paying rent, having those pay cuts happen have been really difficult. But then, like Jeremy said, some folks were able to save money. They weren't going out with their office mates as much. They weren't able to go out to dinners or to travel, and so they were saving funds at the same time. And so what does all this mean for their wellness? We saw very layered experiences. So, mental and emotional responses, we saw an absolute increase in stress, anxiety, overwhelmed nature, and then the pressure to stay caught up, to be responsive, to be responding to international partners, to be responding to parents, to be responding to staff and students at institutions. And so that they saw kind of these, bell curve experiences of those types of stress based on cancellations. Initial, very, very much high stress. Then once a program would get canceled, we see stress again because it required so much extra labor. And also just thinking through that the crisis of when everything first happened really had an effect on their wellness overall. And then we see social, again, that shifting of what they've known to be the organizational structure and how they've been able to manage their wellness as walking with their coworkers at lunch, having these opportunities to connect, and then losing that opportunity really influenced how their social experiences happen. And then lastly, many of them relied on physical activity to cope with their wellness. So they talked about having to get out and walk or run if possible so that they could have that time for themselves. And so we see this tension here of these dimensions of wellness were very much things that were out of their control, but affecting their wellness in multiple layers. And so as we think of this implications, overall, we see this increased stress in the crisis response, which really does align to literature that we know in crisis response, stress is going to increase. And so, what can we be doing structurally as organizations to be thinking so that we know we can't avoid that stress response, that is going to happen, but what are the things that we can be having that are proactively in place that can allow for that structural support so that we see hopefully a little bit less wellness concerns right away. And some of that could be thinking of having some cross training thinking of having the agile staff that can work across areas so that if someone needs to take a break, someone else can step in. Communication, again, was that key piece. And so needing to hear from multiple levels within the organization. Also, our participants talked about the sparseness of debriefs and kind of connection. And so, implementing debrief activities that at least allow a space where our staff can feel that they can share. I think about that often, that sometimes people just need to share how they're feeling. And so being able to provide that space is important. And then also, again, proactively integrating a wellness structure so that it's not so much of a surprise, since we know that crises can increase stress and stress response. Creating wellness activities and well-being, things that are going to be agile in an in-person or virtual environment, so that we can really support the wellness structures of our participants and our staff. So now we'd like to open up for a discussion. We have talked at you for a lot of this time, and we're really excited to hear from you all and some insights and takeaways that you had, especially as you think about some of the experiences that you shared about in the poll. So I think initially, if you just are interested in this, I think we can do, if you want to put something in the chat, or if you would like to raise your hand, we can kind of facilitate this discussion. So our first question, and I mean, you're welcome to answer anyway, but some things to think about that you can respond to are just some of your reactions to the stories, or maybe some of the implications that we just talked about in regard to the discussion.
I can go, Kerry. It's Holly here in Mary College in Ireland. I thought it was fascinating. It's so interesting, the different responses that people have, and there's so many different factors affecting that, and some people can have an extremely negative response and an extremely positive response to the same event, because it can hit them differently at different times, and how some people might be the type of person who likes to plan ahead into the future, and when they're not able to do that, it affects them. They get really stressed, and others are more kind of live in the moment kind of people as well. So it depends a lot on how people generally react to crises anyway, and just being so responsive and the checking in and seeing how that helped people is really, really interesting as well. And we'll just try and keep that in mind too when managing the team, and make sure that we continue to do that. So thanks so much. It was so interesting.
Great, thank you. I think that's such a great point, because even as I was sharing in the discussion of, well, we could just offer space where people can share their feelings or how they're doing, that's going to be a certain personality, like you're saying, right? There are going to be some folks that want that space to talk about in the organization, and there are going to be others that are going to be like, I'm good, right? We can just move along. So as managers and leaders, how do we provide space that accounts for both needs, right? And I think that's I appreciate that reflection so much of how do we negotiate the multiple needs of our staff in regard to things like this, when we're also maybe managing up and down at the same time, and knowing that we're having to navigate what we're having to share up and some of those responsibilities. So thank you so much, Holly. That was great.
Kerry, we have another point in the chat from Leanne, who talks about communication and the differences between internal and external communication. That there may be a disconnect there, right? That the outward facing communication to the public or to the community may not match the communication that members of that organization or institution are receiving. I don't think we heard too much about this as part of our research study. I think most of our participants' stories really focused on their experiences with some of the communication issues within IGEE, and how they really relied on kind of this pre-COVID style of communication that didn't translate very well to a crisis situation. So I think had the organization perhaps engaged in some of those reflection sessions or debriefs that Kerry brought up, I think that maybe could have been an area of growth for the organization. So as something perhaps to tuck in the back of your minds, think about the ways that your institutions and organizations have processed through the past few months. What are some of your areas of improvement, and how is your organization going to move forward by addressing those?
And Stacy talks about in the chat, it's very true. We're still in the thick of this. We're still in this moment. And even as we've been finishing up our manuscript, seeing some research that's already coming out and kind of navigating this time capsule idea of what the study is. And yes, thinking from 5 years from now, reflecting on those memories and what's happening in that moment. I think that's something that I'm very fascinated with, particularly thinking about the differences of our participants. So especially if they're more of an entry level and they're still navigating their professional identity and they're having this situation, whereas I think some of our professionals who had been in the field were a little bit more, their wellness is a little bit more calm, and they were okay because they had navigated crisis before, right? They've had that experience. Not that everyone's had an experience like this necessarily, but we've had some work experience that has guided that direction. And so I keep thinking about that same question of what is that going to look like for the entry-level participants in our study, and how are they going to reflect back? As I think about teaching our students in master's programs right now, I think about that. I told them last night in teaching, you're never going to have a moment like this. You're going to remember this forever, right? And you're always going to have this moment. You're always going to remember this. And so thinking back is a really important piece. And then I think, and it talked about the identifying of the second question, how the effects of physical absence from colleagues has a negative impact on feeling isolated and depressed. And certainly I think we're seeing that kind of broadly in our literature and broadly in nationally syndicated reporting structures. And I see that in the Times and stuff, seeing that, it is providing the spaces where it has negatively affected a lot of people generally, right? Because we can tend to be social folks. And so what does that mean? Is it the work experience? Is it my personal life, and kind of navigating both of those? It's hard to kind of disentangle. I really appreciate that reflection. And then I think we do have a hand up as well.
Yes, it looks like we've got a question from Sibusiso Chalufu. I apologize if I've mispronounced that.
Yeah, no, thanks. Thanks for the opportunity, and good afternoon or good morning, depending on where you are, or good evening. I just wanted to say, firstly, thank you for this fascinating work. I think this is quite an important piece of work. More so because more often than not, we spend a lot of time caring about the wellness of others, the wellness of our students, and we forget about ourselves. I always think about us in support services, we're more like mothers. Mothers will take care of everyone and forget to take care of themselves, Yeah. And so the studies of this nature are quite critical. Secondly, I think that the stories that you have encapsulated are quite critical for us, especially in the support sector, or more focusing on student affairs and services, because I seriously believe that these are stories that still need to be told. I'm looking forward to the book, and especially in the context of our country in South Africa. There's a study that we started working on. I don't know, you might be aware, between 2015 and 2017, during the fees must fall era, a lot of support staff went through hell, and I mean hell, and again, those are the kind of stories that have not been told. In terms of mental health, there are some who are still struggling now, and so your focus on wellness, but also on the issue of mental health, I think that's quite critical. And lastly, I just want to say that working in the support services, it's important for us to have opportunities for reflective practice, what Giovanni calls reflective practice, because we get so sucked into the day-to-day, into the business, and again, that like those mothers, we do everything else, we take care of everything else, but we forget to just step back and engage in reflection and look at how do we then move forward and how best can we navigate. And in a way, for me, if you take away the deaths and all the suffering and all that, I actually welcome COVID-19 because it actually has opened our eyes to all sorts of things and actually forced us to rethink the way that we do things. And you know, just a simple example, I used to laugh at work because I will go to the office, say, around about 10 or so, and because I will mostly be working from home and go into the office when needs be. But it was frowned upon, you know,
Yes,
and
yes.
now I look back and I'm thinking, let's see what is happening. So I'm just saying there's all these kind of things, but thanks for organizing this and allowing us to tap into this, and we're looking forward to it. Thank you very much.
Thank you. I love that so much. And it very much is, you know, very much connected to my research and my dissertation. So I love it because I think I tried to provide those same recommendations that we can have flexibility. We can offer autonomy for our professionals to make decisions on what they need. And everyone was like, we could never do that. We could never let someone work from home. We could never, that would not work for the organization. And then we quickly saw that we could do that, right? And so I think you're right. It's like, what are these moments that have caused disruption? Yes, it has caused a lot of pain, grief, and despair. And also, how do we slow down and reflect and think about what are the practices we need to think about to move forward? We've learned these lessons. And so I really appreciate that so much of what you shared. I'd love to kind of continue that conversation with you. Thank you.
Looks like we have another comment in the chat about plans for perhaps expanding the research study to have more of a quantitative approach now that some of these initial stories have been shared. I know my personal approach as a researcher is to move in a qualitative direction. I just don't have the strengths as a quantitative researcher, but if Kerry led me in that direction, I'm sure I would follow her.
Thank you. Yeah, I think it's a great question. I think there's an importance, and I think some of the literature we provided talks about kind of, I always call it big data, right? That really get at the vastness and the information across and really looking at trends. So I would certainly be open to it. I think we just have to figure out that right audience and that right question that helps us get to it and which scale we'll use. So I am very similar to Jeremy. I love hearing the stories. I love understanding the nuance, and that really gets at what's happening. But I think there is a really big opportunity to expand and really understand more broadly what's happening and if we see any significance of some of these factors. So I love that idea. You're pushing us to think a bit more about next steps. So thank you. Yeah, so I think, thank you, Jennifer. That's a really good point. I mean, I think it's similar, and I think to Subusio's point of, we are always talking about wellness of our students. And I argue that our students become us, right? And so we study and we care for the wellness of our students, and we survey them, we understand that, and then we kind of stop and recognize, or we need to kind of maybe, recognize and think about, how are we continuing that inquiry for ourselves? So I think that's a really good point of, we already have instruments that we could be exploring, that we could be applying to our staff at times. Great.
Lisa, I want to be mindful of time. I know we've reached the hour mark, so I didn't know if IASAS had any final remarks that they'd like to offer to our participants today.
I think Tad might have something, but
yes.
Thank you, everyone.
So first off, I'd like to thank Dr. Kerry and Dr. Jeremy again for a very enlightening and well put together session. I also just want to acknowledge that I think we had people from 9 or 10 countries spanning 4 continents. So the feedback and the conversation was very enlightening. So we thank you all for engaging in this, our first knowledge session. I also want to let you know that we will be doing some additional knowledge sessions coming up in March. We are looking to have one on assessment on March 4th, and information for that will be sent out here soon. So we thank you for joining us today. We will try to make this recording available if you want to come back and revisit or share with colleagues. It should be available on the IASAS website as soon as we can get that made available. So thank you again for joining. Thank you to our presenters, and join us again for one of our future informational sessions.
Thanks, everybody.
Bye-bye, everybody. Bye.